The STAR van has responded to 1,600 calls since June last year, sending a paramedic and mental health professional instead of a police officer to specific types of 911 calls.
Welfare checks, syringe disposal, suicidal crisis where someone is not in imminent risk.
Carly Salon is the STAR operations manager. The support team assisted response does not currently cover all of Denver. Right now, one van is available in Denver Police District 6, downtown, Monday through Friday, 10 a.m. to 6 p.m. The program is seeking to expand. More vans, more teams, covering all of the city, eventually 7 days a week, 6 a.m. to 10 p.m.
We hope to have 6 by the end of the year, and that should certainly be able to cover the need of the city.
Out of 1,600 calls, police have only been needed twice.
It suggests to me that we are appropriately responding to behavioral health concerns as they're coming into the 911 call center.
Jeff Holliday is the public health manager for the city's Office of Behavioral Health Strategies. He's been keeping track of citywide calls that STAR could respond to if STAR was available citywide. Instead of 1,600 calls in DPD's downtown District 6, STAR could have responded to 7,600 calls in any part of the city.
Clearly, the fact that we've served over 1,600 residents, and only 2 of those have had follow-on requests for uniformed officer, is a success.
STAR now has $3.8 million in funding, part from the city, part from grants.
We have not taken any money from the police budget. We have not run this as a defund the police program. We actually have had a long working history with DPD. 34% of our calls are actually police showing up on scene first and requesting for STAR to come take over the call. So this is very much an and, not or.
Those 2 cases I referenced out of the 1,600 where an officer was needed, according to Salon, it was not for a safety issue. It was not to make an arrest, but simply to answer some information that the STAR team could not. So still, we have a perfect record, according to the city, about STAR showing up and no arrest needed and no safety issue.
You hear them reference it's not about defunding police, necessarily moving money out of the police budget. And you'll hear law enforcement say, if we're spending our time being social workers or mental health counselors, it's not a good use of our resources.
It's a fraction of what police get, and police are freed up now with the STAR program to respond to more serious situations where you might need an arrest or you might need that officer.